Ndoge idea. So. Iko nyadi. Inalai. Wow.
Welcome, Mr. Jalo.
Aliou. Yes, Mamadou Aliou Sonko.
Mamadou Aliou Sonko.
Yes.
Okay, welcome, Mr. Mamadou Aliou Sonko to Kerr Cherno Health Center. My name is Sako Sise, officer in charge of the health center. I have served here for 4 to 5 years now. I am a midwife. Yes, a nurse, a general nurse, but also a midwife who delivers services to patients within the health center and outside the health center. The health center is serving almost 30 communities, 30 villages coming to seek health services within this health center. So the services we provide here include daily outpatients, that is seeing patients who are sick to the health center and conducting deliveries, providing family planning services, immunization, weighing infants, and seeing mothers with complications and refer them when necessary. We also conduct outreach clinics to 8 villages where the whole health facility team will be going to immunize children outside and conduct family planning services and see patients who are sick during RCH services. We also conduct deliveries in the health center. We have a delivery room, we have an ambulance, but that ambulance is providing double services. That is, the ambulance is responsible for referring patients to our referral center, that is SL, nearly 28 kilometers from here. It's also responsible for the health facility errands. And the ambulance is also used to go for outreach services to other 8 villages where we trek to. Those are the services we render. We sometimes also admit patients for minor illnesses like pneumonia, malaria, and maybe diarrhea for observation. Yeah, those are the basic things that the health facility does. Antenatal care, immunization, infant care, and outpatient services, conducting also deliveries and providing family planning. We do is laboratory services. We check lab services for antenatal like VDRL, HB, urinalysis, blood sugar, and sickle cell tests. All those services are conducted here. So the services, I think, is finished.
Yeah.
So the challenges we have is lack of staff is number one, because it's a provincial health center staffs are not motivated to come and serve within the provinces, because most of the staffs will be wanting to go to the urban areas because there are many opportunities there. So the other challenges is lack of drug or inadequate drug supply, because drugs is the health center. Without drugs there is no health facility, because we are seeing patients and here is a peripheral health facility where we are not close to any pharmacy. You see, any patient you see, you should prescribe the required drugs for him or her to go with. If it is not available in the health center here, it is very difficult. That is our number one challenge: inadequate staff, inadequate drugs, and the ambulance also is not in a good condition, and the ambulance is doing multi-task. The ambulance is only for referral. Suppose it was normal, it's only for referral, but we are using the ambulance for referral, collecting drugs and other errands that the health center is doing. We are using the ambulance also to go for RC, that's outreach services within other villages. So that also is a challenge. The other challenge is poor road network. There is a very bad road within here up to SL. So if we have patients who are bleeding or who are critically ill, it's always very tough, because before you reach the good road, the patient may...
Like Bengali?
Yes, like Bengali or Sambakana.
Yeah,
before you reach the good road, the patient may suffer, because it will take more time, because the road is not good and the vehicle will be making a lot of noise. That is not comfortable for the patient. That is a big challenge. Poor road network is a big challenge, you see, because sometimes coming here for staffs is very difficult, because during the rainy season some vehicles will not enter here because the road is not good. So it's the ambulance who we are using to ferry us out, because we must go and see our parents or our families, and we must come back to work. So coming is very... Transportation that is a major problem. Transportation issue is a problem within this health facility. And again, the other challenges is electricity. So because as a health facility, the electricity should be 24 hours, but we are not having electricity 24 hours due to the limited supply of gas well we are receiving. Because we are receiving 200 liters for the whole month. We normally put on the generator from 7 to sometimes 6. 7, sometimes 6, sometimes 7 to 1 o'clock. If we have emergencies, like you need a baby who needs to be resuscitated, a baby who needs oxygen, we have to put on the generator. If we have to sterilize our machine for the delivery kits to be sterilized, we must have to put on the generator. So if we do that for a month, that 200 liters cannot keep us. We have a solar system, but the batteries are the problem, and the inverter. Those are the challenges that we are facing. Inadequate staffs, inadequate drugs, poor road network, the ambulance is not in good condition, and again electricity problem. Yeah. Like innovative, what would I do now to change the health center? Yes, staff should be adequate. The staffs must be motivated. There must be a motivation for staffs to be here so that they can serve. Because if staffs are not motivated, they are not willing to come here. The accommodation is there, but the accommodation should be very, very encouraging for staffs to be there. Like the accommodation should have beds, seats, you see, and all those social amenities like television and other things, where the staffs can be motivated, at least for them to stay within here for a number of years at least, so that they may not think of going to the urban areas for greener pasture. There should be maybe incentives again that the staff should have that will motivate them to stay compared to what they will earn when they are in the combos, because they will have more opportunities in the combos, but here you don't have opportunities and you just work with your little salary. There is no other allowance that you have. So if I am given the opportunity or to recommend for what changes is motivation, staff motivation. There should be conducive environment for staffs to be highly motivated so that they can stay within the health facility and deliver the services as expected. So the other thing is the electricity situation should be very good because we conduct deliveries without electricity. We conduct critical suturing without electricity. You see a patient during the night hours, odd night hours without electricity. So all those things are risk factors towards delivering quality services. So if I am given the opportunity or to recommend what changes with electricity should be available. So the laboratory services also should improve. Like most of the reagents within the lab are not available. They should also be available so that we can also have somebody who will be doing the lab services 24/7 at any time in our doorsteps. So the other thing is like if it is possible or if help can be like a vehicle that is specially for RCH. A utility vehicle should be provided for the health facility that will be used only for RCH. So the other challenges is like now we are in the technology era. So the facility should be equipped with computers and laptops, at least for other statistics to be analyzed within the health center. All those things is important. So the staffs to be motivated, number one. Social amenities to be created for staffs, the ambulance to be just for referral and a utility vehicle be provided. The situation of electricity should be available 24/7 and staffs and adequate, the drug supply should be adequate at least, and the laboratory services also should be improved, like the reagents that are not available should be provided for the health center. Yeah. So what the community to do? Yes, the community need to support. The community should be aware of their health problems, but they should also support the health facility staffs, so that they can deliver quality services to their patients. The community should see the staffs as people who come here to work. They are not citizens of this place. We will stay here for just a period of time, and when our time elapses, we will vacate. But the health center belongs to the community. Anything that the community does towards this health center is for the good betterment of their people, not for the staffs. They should see that in them, and that's the idea that they should have. The health center does not belong to the staff. We are given the mandate or the authority to run the daily activities of the health center, but it's not our own. So anything the community can do is the support and let them be cooperative. Let them not see the staffs as people who are not willing to do certain things. Because as a community, you are here, but understand the staff that we have limited on the ground. If you are sick, report to the health center early. Don't wait until late night or you say it's busy because you are from Kerr Cherno here. You say, let me just come around 9 because I am working 24 hours round the clock. So reporting to the health center early is better. That is very, very better. So community participation is very, very important towards delivering quality services. The community again can mobilize each other and mobilize other philanthropists so that they can help their health center to have so many things, and the health center to be upgraded to even a major health center where operations can be conducted or blood transfusions can be conducted, so many things can be conducted. So that this health center can be a major health center within Niumi district. All those things is the innovative of the community, because the community members have to be involved and they must have to see that they own the health facility. Kerr Cherno alone is not the owner of this health center because it is serving 30 communities. But Kerr Cherno is the owner in the other sense because it's within their village. So anything is Kerr Cherno. Even community settle, environmental sanitation, the Kerr Cherno people should force initiate it so that other people can come and assist. Because other people outside, they are seeing that Kerr Cherno is where the health center is. They don't own it, but it's the privileges that Kerr Cherno have, no other communities have, because you can just walk few meters and come to the health center and have your medication and go. But with other communities, they are far, maybe 3 kilometers, 4 kilometers. Before they reach here, it takes time. So Kerr Cherno people and the other environments should engage each other so that they can have better things for the health center, so that the health center can be upgraded to a higher level, so that many services can be provided here. Many staffs can also be motivated to come and work in this area. So those are the community participation. So the number of beds, though it's a minor health center, like Kerr Cherno Health Center is a minor health center. A minor means we are limited to certain services. We are not rendering other services, because we have 4 beds, that is for the antenatals. We have 2 beds for observation room, where if anybody is sick, like pneumonia or malaria, we do admit you and observe you until you are better. So the postnatal is after you deliver, you are there, or before you deliver, you are there, we load you. Or if you have any problem after deliveries, or you have any problem before delivery, you are admitted for services to continue. So that's the capacity. The average number of deliveries in a month is like 40, sometimes we go to 50, but the average that is 40, 43, 45. Yeah, average that you can take maybe 43 deliveries in a month. That's the average. The referral rate, yes, referral we are referring, but not that much in a month. We do refer pregnant women with complications. That is not many. We do refer children with complications or neonates with complications after delivery. But in a month, maybe 2, 3 referral with sometimes pregnant women, or once sometimes. Neonatal maybe 0 in a month, or sometimes 1, 2. It's not that many. Okay. Yeah, the outpatients, yes, we do refer sometimes. Yeah, but not that many. It is not up to 15 in a month. All the referrals in a month is not yet up to 15. So the difficulties, yes, as I said, the difficulties are the challenges. That is inadequate drug supply, poor road network. So electricity is a problem. So staff is a problem.
What about water supply?
Yeah, water supply, there is no much difficulties, because we are having water 24/7. Yeah, we are having water. So the only thing maybe the community can do in that aspect is for the health center not to pay, because we are paying. The health center is paying the community that water bill.
It's paying water bill.
Yes.
To the community.
Yes, to the community.
So you connect your pumps to the.
Yes, to the community.
Okay. Okay.
So we are paying on that aspect. That is the only challenges in terms of water. We have a borehole in the health center, but that borehole had a problem. So we are connected to the village. So if the village can do anything, not for the health center not to pay, that will be better, but we are paying the water. I think basically that's it. So yes, any assistance that is needed or that is available for the health center is highly welcome. Drugs, beds, medical equipment like blood pressure machine, thermometers, even laptop, all those things, screens like television sets, all those things, because we have television sets, about 3 television sets for the health center, but if we have more orders, it will be better. So any assistance that is needed, like even plates, even baby towels, baby clothing, all those things, just to motivate the women who deliver here, so that they can have something after delivery. They go home with those towels with their babies, even baby hats, even some socks or shoes. All those things are motivating. So we do have some, but SF Health Center is the one who donated us, because those people have tubabs who come to donate them. So if they donate them, they extend their hand to us. So they extend their hand. They donate us baby caps, towels, and baby wrappers that the baby should need, and the clothes sometimes is from SF, but not from the medical and health.
So right now, how many staffs are here?
What the nurses or all the staffs?
Both, yeah, all the staff.
23.
And 3 are here.
23.
Nurses?
Nurses, like the 3 nurses, we are 4.
4.
We are 4.
So you have good, like the toilet is good or?
Yes, toilet problem is not there.
It's not
we
there.
have enough toilets.
Enough toilets.
Yes. Those people constructing a toilet. They are constructing a toilet for us. That area.
So the staff toilet and the patient toilet is
Different. No, the rooms are having their own toilets.
The rooms are their own toilet.
Yes.
Okay.
The rooms are having their own toilets.
Thank you.
Kiri dafa bëri trop. The big team like real kiri dafa bëri trop.
Ama kero sa waji naka la def Abdourahmane.
Mu ngi hultu rek kale bi rek. Ko wala beson na.